Hi everyone, I am Dr. Mahesh DM, consultant endocrinologist practicing at Aster CMI Hospital, Hebbal, Bangalore. Today, I will be answering one of the common questions that people ask me: how do I take care of my diabetes? So the best way to manage diabetes is to be aware of 7 important things that help in addressing the diabetes and its related complications that we may face throughout the life. So in them, the first is healthy eating. Healthy eating includes the following things that we should avoid and the important things that we should include. The things that we should avoid are high glycemic index food like simple sugars, simple carbs, and adult processed food and fatty foods that are frozen or foods that are processed and fried. These things we should avoid. The things we should take are whole grains, fruits, vegetables, healthy fats and healthy proteins, and take adequate amount of vegetables and fruits that should ensure that we get minerals and vitamins. In this way, we can manage our diabetes well with healthy eating. The second important thing is to be active. Being active not just is to walk for half an hour a day and be sitting throughout the day. Being active is a process of being active throughout the day, where at least after 40 to 50 minutes of sitting, you move for 2 minutes with your schedule, whatever you have. So we have included, in our education, people have bought treadmill tables, and they also, start walking for drinking a cup of tea or a cup of coffee. So you be active throughout the day. You park your car in a faraway place so that you can walk when you are parking or when you get back to the car. So to be active is not just walking half an hour a day and leave it like that, but walking half an hour a day plus being active throughout the day, so that your glucose levels are regulated in the entire day and not just for a short period of time. The third important thing to manage glucose is to be aware of the glucose levels. For that, we have to monitor. Monitoring includes monitoring the blood glucose level, that is the fasting blood glucose, postprandial blood glucose, and the 3-month average blood glucose known as the HbA1c test. Along with this, we should also monitor our lipid profile, blood pressure, and other inflammatory parameters, the renal function test, the liver function test, and also look at the hemoglobin and other parameters once in a year. Further, we should also monitor for complications, which include monitoring of testing the eyes once in a year, and also looking at the feet every visit or at least once in a year, to ensure that we are aware of the complications that may set in. Further, time to time tests may be required to assess the function of your heart, your liver, kidneys, and also along with the blood glucose levels. So the fourth thing is to ensure that you take your medicines on time. Taking medications on time is the best thing you can do for helping your glucose levels to be regulated. So there are some medicines that you can take in the morning before meal. Some you have to take after meal, either in the morning or in the night, sometimes in the afternoon. So these medicines have to be taken on time. Along with that, taking medications also includes taking medicine, that is insulin, if you are on insulin, on time. It is very important to take the insulin on time, because insulin has an onset of action, a peak effect, and a duration that is dependent on what time you take the meal. So, and what time you inject the insulin. So there should be a coordination between the insulin time and the meal time, so that you get the optimal blood glucose level. So taking medicines correctly without missing and on time helps to regulate your blood glucose levels. So managing diabetes includes also the ability to solve the problems that may arise from time to time. So usually what happens is that we take our medicines, we monitor our glucose levels, but sometimes we see that our work schedule is different, or we are under stress, or there is some other illness that comes up. So, or you may moving from one place to another, or the temperature may change. So these are the ability to navigate through the various situations in life. You have to be able to solve the problems that may arise. So for this, you have to talk to your healthcare provider and diabetes educator that helps you to take care of travel, to take care of your shift timings or the change in the season, and also to ensure that the stress can be managed adequately. In this way, you can solve the problems that may arise from time to time, and also know about 6 sick day rules that you are required whenever you may fall ill. You need to manage your glucose levels in a different way compared to when you are healthy. The sixth and most important aspect of diabetes is the ability to cope with diabetes in a healthy way, which is known as healthy coping. This is not just an individual thing, it is about the family support and the circle of friends and workplace support that a patient with diabetes may require. So therefore, it is very important to express your concern whenever you have, if you feel distressed, if you feel depressed, or if you are not happy with the way life is moving on. Please express yourself with your family member or your workplace support and ensure that they understand what are the difficulties you are facing and make the necessary changes that may be required either at home or at workplace to cope with the glucose levels that will fluctuate because of the inability to cope with your diabetes diagnosis because of the age of onset of diabetes, or sometimes because you were not expecting that you will get diabetes and somebody tells you as a shock. So the initial phase you require some adjustment to your lifestyle that may require support from your family. So please inform your healthcare provider to talk to your family members and workplace to help you cope with diabetes. So managing diabetes is not just taking medicines, monitoring the blood glucose levels, but also ensuring that we reduce the risk of complications that are a result of diabetes and its glucose levels that will be uncontrolled. So uncontrolled blood glucose levels lead to a lot of complications that will affect the blood vessels, that includes the heart, kidney, brain, the lower limbs or the fingernails or finger toes. So the skin and also the internal organs like the kidney and the eyes. So these are the complications that will arise because of diabetes. So we have to reduce the risk of developing these complications. For that, we have to keep our HbA1c levels less than 6.5 to 7. We should also ensure that our blood pressure is under control, our lipid profiles are very good so that we take the medicines required to bring it under control. And also manage weight, and at the same time screen from time to time whether we have any complications at an early stage, so that we can take the necessary lifestyle measures, which includes healthy eating and active living. Along with that, take the necessary medicines in order to reduce the risk of complications because of diabetes that will be there for you as a lifelong partner. So we need to be doing this as a regular basis to ensure that you don't get future complications.